Hi everyone. I want to talk to you about elevated platelet counts today. My name is Dr. Alex Eson. I'm an oncologist, hematologist, and quite often I get confronted with patients who come in to see me because their primary care doctor had checked the CBC and their blood count showed a platelet count of 4 or 5, sometimes 600. I've seen them as much as up to a million platelets. And it could be somewhat alarming, especially in the case of a patient who has a blood clot. So, generally speaking, platelets are little small cells whose job is to keep us from bleeding out when we have a cut. I had a patient of mine who came to me, 45 years old, and she had been seeing her primary care doctor, and the thought had been that her platelets being low had a lot to do with iron deficiency. They had checked iron deficiency, and she didn't have any of that. There were no infections. There was no sign or symptoms of a autoimmune disease like lupus or inflammatory bowel disease or arthritis. Uh, she had no damage done to her spleen, and so an abdominal ultrasound was done. Uh, when I saw her, she was already, I think, at a platelet count of 700,000, was taking a baby aspirin a day, and I went ahead and I ordered a blood test. Really not rocket science. It's simply a test that's commonly done looking for three mutations, and the three mutations are called JAK2, CORL, and MPL. Uh, since other causes of elevated platelet count, like iron deficiency, were all ruled out, uh, luckily, we were able to get JAK2 mutation positivity back, which is usually up to 45% of the patients. I did a bone marrow biopsy on her because I wanted to make sure that we weren't missing anything. It confirmed the JAK2 mutation, and I repeated back some of the previous blood tests that was done, and really her symptoms were somewhat vague. She had headaches occasionally. She had had a couple of episodes of visual changes and dizziness, which she thought had to do with excessive hiking. But what she told me that was kind of interesting was burning pain and redness in her hands and feet. And uh, despite heavy platelets, she had easy bruising and sometimes bleeding, which had puzzled her and her primary care doctor. When I saw her, I basically told her that the aspirin was the most appropriate treatment for everybody, and that's mainly because we don't want you to have a blood clot, because a clot would form from the platelets sticking together and go into your lung, to your heart, to your legs, and taking an aspirin definitely keeps that from happening. Medications such as Hydrea, injections with Pegylated, Interferon, and Anagrelide, and follow-up is something that I offered her and I do with all my patients. Luckily, nowadays most physicians know that it's not a panic when you find elevated platelet count. As long as we do the blood test and we go ahead and proceed with looking for scary stuff and rule them out, you should be okay. So this was a short video kind of going over what an elevated platelet count could mean for you, and the actual disease of essential thrombocytosis belongs to the family of myeloproliferative disorders, and it's important to have that diagnosis and keep you from having a clot, and it's easily done. So I hope If you're one of my patients, I look forward to seeing you soon. And if you're not, we'll definitely ask you to consider speaking to your primary care doctor and ultimately a hematologist. Best of luck to you, and I hope everything works out well for you.